I'm a breast radiologist, and here is how I handle when a patient declines a mammogram. So the recent passing of Ananda Lewis has had me thinking about how we handle when patients decline tests or treatments that research has shown to be effective. And mammography is considered the gold standard for breast cancer screening for the general public. But every so often I have a patient coming in and refusing a mammogram, and I don't send them away, and here's why. First, I have a long conversation with them. I ask why it is that they're declining a mammogram. Is it because of the fear of radiation or a prior bad experience? Or are they just scared? Understanding why they're declining the test in the first place is the biggest part of the battle. We talk about the minimal amount of radiation that's actually in a mammogram and that it can detect microcalcifications and some of the earliest signs of breast cancer that ultrasound and even MRI cannot. I explain that early detection is the breast protection because it helps improve outcomes such as improved survival and improve quality of life due to less aggressive breast cancer treatment. We always discuss ways that we can make the experience more positive, such as breathing exercises and mindfulness techniques. At this point, most patients end up deciding to go with a mammogram, but every so often they don't. In which case, I usually recommend a survey breast ultrasound to start. If I see nothing, I tell them everything looks normal, but with the disclaimer that we didn't do a mammogram, so we might be missing microcalcifications or some early signs of breast cancer. Now, if I see something abnormal, then I'm definitely going to recommend a mammogram more as a diagnostic study, or in some cases, I'll go straight to biopsy. But I think as physicians, we need to listen without judgment and understand that people come from different backgrounds and beliefs and respect those while also pointing out in ways that it might be detrimental to their health. But at the end of the day, it's their body and their choice. I'd love to know how you handle when patients are declining tests or treatments that may be detrimental to their health. As always, follow the Boobie Docs for more of the breast information.